It's time for Political Buzz, the television forum to discuss politics and issues of interest for all of Western New York. Now, from the WBBZ television studio at the Eastern Hills Mall, this is Political Buzz.
Hi, welcome to Political Buzz. I'm Phil Arno. Today our conversation is about Ebola. And unless you've been living under a rock, you've heard about it in every newscast, you've read about it in every newspaper article. We have a lot of information out there. Some of it is misinformation. It seems the more we learn about the disease, the more confused we are. The only thing we know really for sure is Ebola is bad. Today, joining us in the conversation and hopefully clearing up some questions is Dr. Myron Glick of the Jericho Road Community Health Center, and also Dr. Stephen Dubowski, the Department of Psychiatry at UB. Dr. Glick, you were in West Africa recently in Sierra Leone, and you didn't, as far as anybody knows, come into contact with anybody who had the disease. But you're still self-monitoring just to be on the safe side.
I am, yes.
The first question, possibly the most basic question, is, do we know how the disease, definitively, do we know how the disease is transmitted? We've heard that it could be airborne, that it mostly is through contact. What do you know about that?
I think we pretty much know that it's not respiratory spread. I know there's a lot of speculation about that, but really the science isn't saying that at all. What we know is that Ebola is spread by contact, physical contact with the body fluids of someone who has Ebola who's sick, or their dead bodies. And so while the virus, we talk about this virus being highly infectious. In other words, if I'm sick and I have Ebola and you touch any body secretions of me,
including sweat,
you would have a very good chance of getting Ebola. But it's not the kind of virus, like say the flu virus, that's spread by respiratory contact that can sweep through a general population very quickly. I think it's really important to your listeners to say that there's no scientists that would say that we think this is respiratory spread.
So you shake hands with somebody. If they wash their hands, would that prevent the disease, or does it go through the skin?
Well, so I think it's important to clarify just a few things. There's zero risk for someone touching me. The fact that I went to West Africa, that I'm a doctor, that I was involved in training and helping set up a clinic and have no known exposure makes me very, very low risk. But even a doctor who was in an Ebola treatment center who is not symptomatic cannot spread the disease. So you don't have to worry about hugging me or shaking my hand. There's a lot of fear about that, but really the science doesn't support that at all. What we know about this virus is that in the asymptomatic stages, even if someone that has the virus inside of them, that they're not contagious, that if we did a blood test, it wouldn't show positive for Ebola. In fact, even the case with Mr. Duncan, it wasn't his family who was around him before he got sick, or even initially when he got sick, that got the disease. It was the nurses who were taking care of him when he was really sick.
Okay.
It's really important. That the whole controversy with me being here and seeing patients has to do with that simple fact.
So if you don't have symptoms and you don't, in fact, know that you have the sickness,
yes, you're
not going to be able to spread the disease.
Exactly.
Okay.
Exactly.
Okay. Well, obviously you don't think there's any danger in your situation. How do you feel about people who have been over there and potentially touched someone and they're not symptomatic? How do you feel about them being subjected to a 3-week quarantine?
Well, so I think that there is reason to screen. I mean, I'm very comfortable with the screening that the CDC has put and the health department are doing with me, where I check my temperature twice a day and I have to report to the health department twice a day. But I can live my normal life otherwise. The CDC has set up real strict criteria for who should be under more intensive screening than what I'm under. And I mean, I support the CDC. I trust our scientists.
Mm-hmm.
I struggle when, and actually was really disappointed when our politicians, who we elect, you know, to serve us, but also to consult with scientists and make good judgments, I feel like they put the fear, the general fear in the public, before what the science is saying we should do. And the unintended consequence of that, if you're going to quarantine every doctor and nurse who served in West Africa, it has a really adverse effect on us, I speak generally, going over there. And yet we desperately need doctors over there now.
Dr. Dubovsky, a nurse was put into quarantine just recently in New Jersey, and she became quite indignant about it. I mean, she thought that there was no danger, and for people who feel that they're not a danger, to be ordered into a 3-week quarantine and isolation, is that unreasonable to expect them to willingly do that and happily do that just to protect people on this side? I mean, they've donated their time on the other side and to help people. But wouldn't it be just the same thing to protect people on this side if there's a chance?
Well, you have people who feel that they paid their dues, they volunteered their time, they worked hard. Why are you imposing additional burdens on me beyond what I've already done? And that's a very understandable position for that individual. And you have other people around them who say, well, we're not really 100% sure how safe you might be, and it would reassure us. So that individual says, well, why should I lock myself up for 3 weeks just to reassure you when I'm okay? And as you said, there's no chance of my spreading the disease. And there's an accommodation between different points of view. I think to be indignant that you were quarantined when you look at the history of dealing with the potential for infectious disease in this country and in other countries, you know, there's two sides to that story. So that amount of indignation, as I said, you can understand someone having put a lot of effort into going to Africa, taking care of people who are very ill, surviving it, coming back, you think you finally get to let your hair down, and everyone's saying, not so fast. You know, you're going to have to stay locked up for a while, and that feels like a tremendous burden. On the other hand, people are scared, and to say you have no right to do this is a complicated issue. There was a time when we quarantined everybody who came into the United States at Ellis Island.
Right.
And
my grandparents were quarantined. Yeah. With all the attention paid to the subject, do you think it serves us well as in education, or is it just a hype that's basically putting a danger out there that really doesn't exist? It's kind of overblown.
Well, I think you have 3 levels of information impinging on the public. The first is the information you just heard. Here's what we know. Here's what the data say about this particular illness. It's not contagious under certain circumstances. Under others, it is contagious. If you catch it, it's really bad. Then there's, as you said, hype. The media generally don't put something on the news doesn't capture your attention. If it's, you know, someone went through a green light and nothing happened, nobody cares. You know, someone went to work, did their job, came home, did a good job. No one cares about that. Someone ran amok, you know, that we want to hear about. Somebody scared us, that, you know, that grabs our attention. And then the third level of information that we're getting is, as you were suggesting before, political information. It's the data, some of it not even data, just opinions on the illness being run through the political machine. And then what you get back are exaggerated, improbable to impossible statements on either side that are not particularly believable. For example, look at how bad the Democrats are doing. You know, they've got us into this problem. It's President Obama's fault. And on the other side, you hear, there's no problem whatsoever. This is just fine. And there's just a lot of noise from the Republicans. There was someone on TV yesterday, the head of the DNC, I believe, said Republicans are more dangerous than Ebola. So you get this level of hyperbole that is meant to grab your attention, because we're accustomed only to paying attention to things that are very loud and very dramatic. If it's ordinary, we don't pay attention to it anymore. It's kind of like you and I were talking about earlier, the TV shows where there's not a lot of blood and guts. Nobody notices it.
Yeah, we get insensitized or desensitized.
Yeah.
And that's a question when you hear all this attention and all this talk in the media. Is that basically overkill? I mean, do people turn off?
I think what you have is you have two issues. First, some people turn off to it. Some people become excessively frightened. But I think the more difficult outcome is people get polarized. And you already have a country that's highly polarized. And what you get are polarized opinions where nobody's saying, well, I'm not really sure about this, or we need more information. And I think that scares people and makes them distrustful.
Okay, well, that's all the time we have for this segment. We'll continue the discussion as soon as we come back. Welcome back to Political Buzz. We're talking about Ebola with Dr. Myron Glick, Dr. Stephen Dubowski. Dr. Glick, your mission at home with the Jericho Road Community Health Center is to help inner city children. Tell us a little bit about that how did that come about? What do you do there?
So I went to medical school here, and when I was here, I realized that the poor were treated differently than, say, someone that had health insurance. When I got finished with my residency training, decided to open a practice on the west side of Buffalo that would be designed primarily to help the underserved, people that don't have insurance. What I didn't realize at the time is that many refugees would end up coming to Buffalo. Over the last 20 years, Buffalo's become a much more diverse place. And so today our practice has two sites, one on the west side, one on the east side. And we also have about 10 different programs that sort of help us more holistically address the need of the people we serve. Our practice is very diverse. We have patients from 70 different countries. In our office, we have translators who speak over 20 different languages. So we serve an incredibly diverse part of Buffalo.
Do you find yourself overwhelmed with the numbers, or are you basically able to handle all the demand?
Mm-hmm. I mean, you sort of go back and forth. I think there were times in the past where I was overwhelmed. We're a federally qualified community health center, so we have more resources. We've been able to hire more doctors. We now have 15 doctors and nurse practitioners that work with me. So it's not all on me. There's close to 200 folks now that work with Jericho Road that help us serve over 1,000 patients a week. It's not something I have to do by myself.
And what kind of services do you have there? In other words, if someone comes in, with a broken arm, do you send them to another facility, or can you handle anything that pretty much comes your way?
So we're family doctors.
Mm-hmm.
Think of the old general practitioner model. We're now board certified family physicians. We deliver babies, take care of probably 90% of what walks in, take care of kids all the way up through, the geriatric population. Well, we do refer. We have specialists that we work with, so we don't, for instance, take care of broken bones. We refer to an orthopedist.
Well, quite admirable, and it's quite a help to the community, and I'm sure everybody appreciates that.
Thank you.
Dr. Dubowski, we talked earlier a little bit about the exposure that the story has gotten in the media, and it seems when the media latches on to a story like this, especially a story that scares us, And we talked earlier about Y2K and then the bird flu and various other things that the media has kind of treated like this story. When that happens and it gets all this exposure, quite often politicians get involved. And they sense that when everybody is scared, when there's this much publicity, there's money to be made. Or at the very least, there's political currency that can be made. How does that affect the psychology of what we're going through? I mean, it's in their best interest to keep it going. And the people, the viewers, the people who basically aren't the experts, you know, they're bombarded with these things.
Mm-hmm. I think you can understand the psychology of the current climate by watching any zombie movie or zombie TV show that's out. Because if you look at these shows, how are they characterized? The world is falling apart. There's some horrible thing that is infecting everybody. And the world is divided into small groups of people who have to depend on each other, and you can't trust anybody else, and everyone's out to get you. And you think, who on earth would want to watch a show like this? Other than for the gore, you like gore, but why would you want to watch something like this? And to my view, it reflects our current division within our country, where we feel whatever political group we're in, whatever belief we hold, this is us versus them. And listen to any politician of any ilk whatsoever, and they're going to refer to anyone in the other party as them. And they're going to refer to themselves as we. And as long as you do that, they don't talk to each other. So this is now in the United States or in any country, the leaders of the country are like the parents, and we're like the family. And all the parents want to do is fight with each other and yell at each other, and they never decide anything. And what you get back when you say, why do I have to do this? They say, well, because I said so. Or they crank out some, some spiel or other that's completely unfounded. And what's happened is, because of our own divisiveness within ourselves as a population, we've elected politicians who feed off of this, and they apparently can only get elected if they perpetuate the notion that it's us against them. Now, if you're a child growing up in a family where all the parents do is fight, you get pretty scared, and you feel like you can't trust anything that anybody says, and you're always in danger. And you better hang out with the people you know and the people who think like you do, so you'll be the only way to be safe in what feels like a very unsafe world. So, to my mind, from a sociological standpoint, we've evolved a political system now where politicians can only get ahead if they argue with each other and don't accomplish anything. And we say, we want you to accomplish things, but we're not going to elect anybody who's actually going to do that. We want to elect people who are with us and against them. And I think this is contributing to us feeling very fearful about a lot of things. And another thing about being in a family where everyone's yelling is nobody can hear you if you're not screaming. So you try to say, I'm really hungry. Nobody's listening. I could use a glass of milk. Nobody's listening. Give me milk, or I'm going to blow the place up. Then people start listening. So that's kind of what we've evolved. They say people get the politicians they deserve, but it seems to me we deserve a little better, a little higher level of discourse here, where the parents actually say it is our job as parents or as leaders to talk to each other and to create a safer world. Instead, what you get is it's our job to calm you down and tell you to shut up, but the kids don't believe that because they know it's chaotic.
Well, it's one of my favorite subjects, so that's a whole nother show. I love the way we can talk about human nature and how it's affected and why people do the things that they do. In West Africa, your experience there in Sierra Leone, obviously it's a different world. People here in Buffalo, in Western New York, in the United States in general, they have a hard time identifying with what goes on over there. They don't really they would be kind of shocked at some of the conditions. There's a story out now that the cases in Liberia are going down a little bit. I'm not sure whether that's because people are staying home and not going to the clinics, or whether it's actually in a downturn. Tell us a little bit about your experience in West Africa. Was that the first time you were there?
No, I've gone a number of times. We followed, Jericho Road has followed one of our longtime nurses who came to us as a refugee from Sierra Leone. She came to me a couple years ago, said, I want to start a clinic in my hometown in Sierra Leone. So we moved there with her. I mean, she went there, we moved, helped support her to build a clinic there. I mean, in the district that she's living, there's 540,000 people and 3 doctors. The hospital has no sonogram machine or x-ray machine. People, if they need a C-section, often have to buy the fuel to run the generator before they can get the C-section. So the healthcare system's already devastated. Now you bring Ebola into the mix, and there's just hardly enough structure. I asked people when I was over this past time, what do you need besides the obvious, which is more beds to treat the sick? People aren't getting food when they go into the holding centers. When the families are quarantined, they often are starving. There's not enough burial teams. There's not enough fuel to run the ambulances. People are lying naked in the Ebola treatment centers because they don't have hospital gowns. So it's night and day between what we see in Sierra Leone, where people are dying by the thousands, and this is far from being contained compared to what we see here in the States, where we've had 1 death and a lot of hysteria.
Interesting discussion. That's all for this segment. We'll continue when we get back. Back with Political Buzz. Some final comments. Question for either one of you. Where do you think we're going to go from here? What can we expect in the weeks and months to come?
I mean, I think it's challenging. I don't have any question in my mind that Ebola will just be episodic in this country. I don't think it's something that we need to fear at all here. Because we're a global community, there will be these cases that pop up here and there, but it will never sweep through our communities. We have a good healthcare system here. I'm not so sure about what's going to happen in West Africa, and I guess if things are not, if it doesn't change, we're looking at many more people dying. We need the world to come around West Africa in ways that it's reluctant to do, and we need to try to avoid the fear that we have in this country that's not substantiated.
What can the world do? I mean, how do they help in West Africa?
Well, for sure, doctors and nurses from all over the Western world and other places like Cuba and Ethiopia and everywhere else need to go there. I just saw the UN yesterday say we need 5,000 people on the ground as soon as possible. People can donate to organizations like Doctors Without Borders. And our government, President Obama and everyone else needs to really focus the energy to get the help there as quickly as possible.
We have just about 30 seconds left. Dr. Dubofsky.
I think the Ebola will pass. It'll come back. It'll pass. Other things will occur. For us, if we don't want to be afraid, we should all go outside ourselves. Like you've heard, do something beyond your daily work. Reach out to other people. Have fellowship with other people. Feel compassion for other people. As I was saying earlier, I'm a fireman. I love my brother firefighters. It's something beyond just what my daily job is and makes me fulfilled. Do that. You won't be scared. You'll have fellowship around the world.
So the bottom line is the average person out there in Western New York, in the country, probably shouldn't be too concerned about what's going on. And we take everything that we hear with a grain of salt. Good discussion. That's it for this segment of Political Buzz. I hope you enjoyed it. We try to be informative. Next week, we'll be back with another discussion.